guys, my name is James. Today we're going to be talking about lung cancer. Essentially, what cancer is when your cells multiply and divide, and your natural killer cells are unable to keep up. In our case, lung cancer would start in the lungs. Uh, these cells generally grow within the cell lining of the lungs, generally the bronchi or the bronchioles, and there are two types of lung cancer. We have non-small cell lung cancer, which is generally an umbrella term. This type of cancer is mostly genetic and passed down from family members. The second type is small cell lung cancer, which is most commonly found in smokers.
Hey guys, it's Ralph here. Here I'm going to be talking about the causes and unconnected causes of lung cancer. In unconnected lung cancer, in unconnected lung cancer, it's believed that there's a combination of genetic and environmental causes, such as genetic mutations that occur spontaneously, or they're either inherited through a family member who's had lung cancer before. Additionally, there are environmental factors that play a role in unconnected lung cancer, such as exposure to air pollution, car exhaust, and industrial emissions, like for example asbestos. Uh, and finally, there's like respiratory infections such as tuberculosis and pneumonia, which compromise the immune system by making it more prone to lung cancer. And I'm going to be passing it off to James again.
Hey guys, it's me, James, again. I'm going to be talking about the stages of cancer. So essentially, stage one is, like I said earlier, the cells multiply and divide. Generally, it's contained on like a single lymph node. It's very small. Um, Surgery can be done at this stage with an 80 to 90% survival rate. Generally, most of the patients live. There's not much harm done to the patient. In stage two is generally when the cancer starts to get more serious. This is when that cancer starts from one lymph node and starts to spread to other lymph nodes. It's at this rate when the cancer picks up at a rapid pace and like change is needed immediately.
Hey guys, it's Ralph again. Actually, in the third stage of lung cancer, it's divided into two substages. Stage 2 and 3. This is stage 2 and 3. In stage 2, the cancer spreads to nearby lymph nodes or to other parts of the lung. And in stage 3, the cancer spreads to the chest wall, the lining of the lungs, or nearby organs. At this stage, surgery isn't even an option, and treatment involves chemo and radiation therapy. The survival rate of stage 2 and 3 is actually around 30 to 40% of patients for 5 years or more after diagnosis. And finally, the fourth and final stage of lung cancer is called stage 4, which is the most advanced stage of this disease. At this stage, the cancer spreads to most parts of the body, such as the liver, brains, and bones. Treatment options are limited, and the goal of treatment is often to alleviate symptoms and improve the quality of life than to cure the disease. The survival rate of this is extremely low, ranging from 10 to 20% of patients surviving for 5 years or more after this diagnosis.
My name is Kel, as y'all may know, and today I will be talking about the symptoms of lung cancer. So, some signs of some symptoms that you might have of lung cancer vary from very simple stuff like regular cough or like bone aches, you know what I mean? Or it could be something very extreme like consistent coughing or even coughing up blood, difficulty breathing, stuff of the sort. The stages vary based off of what kind of symptoms you have. Like a simple cough might be around probably stage 1, but when you start coughing up blood is when you're probably in stage 2 or 3, and is also when you should probably start getting checked at the doctor. That's why it's important to go to the hospital and get it checked by the doctor.
Lung cancer, both small and non-small cell, is the second most common cancer in both men and women. Overall, the chance of a man getting lung cancer is 1 in 16, and for women, it's 1 in 17. The 5-year survival rate for people with stage 1 lung cancer is 80 to 90%, for stage 2 and 3, anywhere from 30 to 40%, for stage 4, 10 to 20%, and for stage 5, as low as 3%.
These are treatments for lung cancer: surgery, radiation therapy, chemotherapy, and immunotherapy. Surgery is having a surgeon work to remove the lung cancer. And these are the procedures somewhere. Radiation therapy uses a high energy radiation beam, such as X-rays, to kill the cancer cells. Chemotherapy involves drugs that kills the cancer cell. This generally is used before or after surgery. Before is to weaken the lung cancer, and after is to kill any remaining cancer cells. Immunotherapy is the use of drugs to make your immune system recognize and fight the cancer cell.
To wrap things up, if you or a loved one are experiencing any of the symptoms discussed today in today's presentation, it's important to go get it checked by the doctor. Symptoms like I talked about earlier, like coughing up blood, difficulty breathing, bone aches, all of these things could be prerequisites to lung cancer, and some of them are more extreme cases than others. So, like I said, to reiterate, it's important to go to the hospital and get checked out by the doctor frequently. I hope you found today's presentation informative, and thank you for watching.